Hi, I'm Dr. Daniel Marsh with Marsh Chiropractic Wellness Center in Petaluma, California. And as a chiropractor with 30 years of experience, as well as a nutritional therapist, it's important for me to explain to my patients why I do nutritional therapy along with chiropractic. What's the rationale behind it? So today I want to explain that to you. And in doing so, it's important that you understand how the nervous system works. When you look at the central nervous system that makes up the brain and the spinal column, the spinal cord, that's the central nervous system in the body that controls all the organs, glands, and tissues in the body. The nerve messages travel from the brain down the spinal column and out through the openings between the vertebrae. It gives off messages that controls the organs, glands, and tissues. And those nerves that travel down and out go to the organs, glands. There's also nerves that travel from the organs, glands, and tissues back to the spinal column and back to the brain. So there's constant feedback going on between the brain and the body, and that helps to maintain what we call homeostasis. So when there's a spine-related issue, or in chiropractic we call that a subluxation, that's a dysfunction of the nervous system at the spine level, that can choke off nerve impulses that travel to the organs, glands, and tissues and affect the function of those organs. Conversely, a biochemical imbalance within a gland can send abnormal nerve messages back to the spine and cause the spine to subluxate. So a patient can have spine issues that are actually related to organ dysfunction. In other words, a good example, a common one we see is patients coming in complaining of pain between the shoulder blades. In this area, this happens to be in the mid-back between the shoulder blades, the digestive area. So let's say a patient comes in, they're complaining of mid-back pain. We adjust and adjust and adjust that patient, and they don't resolve, they don't get better, and they don't stabilize. So what we find is that a lot of times patients have digestive issues, which is a very common problem. When we correct the digestive problem, that will then send normal messages back to the spine, cause the spine to begin to normalize. The patients will start holding their adjustments, and they'll get better and stabilize a lot faster. So that's why we do nutritional therapy. We balance the body chemistry, we balance the spine with adjustments, and this is done with nutritional therapy. Another important thing to note is that what we're doing when we're working on the nervous system is we're really impacting autonomic nervous system function. When you look at a nerve fiber, there's three main nerves that do different things, types of nerves. There's motor nerves that control muscle function. There's sensory nerves that transmit pain and sensation. And then there's autonomic nerves. The autonomic nerves are the nerves that control everything that goes on inside of you without your thinking about it. All the organs, glands, and blood vessels are controlled by the autonomic nervous system. So that controls a lot of things, like your ability to digest your food, your ability to breathe, and for your heart to beat, for you to be able to fall asleep at night and then to wake up in the morning. So there's a number of things. The immune system is controlled by autonomic nerves. So it's a very important part of the nervous system. There's two branches of the autonomic nervous system. There's the sympathetic and the parasympathetic side of the autonomic nervous system. The sympathetic side is the fight or flight reactive side. That's the side that's active when a person's under a lot of stress. It can be a minimal stress throughout the day, or it can be a major stress that a person's going through. And then conversely, the part of the autonomic nervous system that opposes the sympathetic is called the parasympathetic. That's the part where you begin to down-regulate, where your body can rest and digest and heal. So you should be able to flow back and forth between sympathetic and parasympathetic throughout the day. Some people are what we call sympathetic dominant. They're stuck in this sympathetic mode where their body cannot down-regulate. There's a number of different stressors that can cause a person to be sympathetic dominant. But it's important to understand that if they cannot down-regulate, the nutritional therapy we find will either not work for the patient, they won't have any response, or they'll get the opposite kind of reaction that we're hoping for with nutritional therapy. So when I'm working with a nutrition patient, the first thing we check is to see if they're what we call blocked, if their nervous system is stuck and they can't downregulate. We have to fix that first before we proceed with nutritional therapy. And through the testing, we check different stressors that can affect that part of the body. It can be a structural problem, it can be an immune challenge, a heavy metal toxicity, even scars can do that. So the testing is very important. That's the priority, is to make sure the patient is able to downregulate so that they can rest and digest and heal. So hopefully that's cleared up some things, and that's why we do nutritional therapy, and that's why we check for autonomic nervous system function. Thank you.